This is Dr. Vainio, Arne Vainio, MD, and I just got cardioverted for atrial fibrillation. I was supposed to take a sauna this morning with my friend Steve, and at exactly 8 o'clock, I could feel some fullness up in here, and my left arm didn't feel good. And it didn't hurt. I didn't have any chest pain, but maybe a little bit shorter breath, but apprehensive. A little bit of a headache right up in here. Still have that. A little bit of a neck ache in the back of my neck. And it just came on all of a sudden. And it was something I was hoping it was going to go away. And then I checked my pulse. I could feel my pulse, and I could feel it was fast and irregular. And I checked my blood pressure. I have a blood pressure machine at home. My blood pressure was actually low. It was, it should be 130 over 80 or less. It was, the first one was 96 over 75. And my heart rate was 136 by that. And I checked it again, and it was, my blood pressure was a little bit higher, but my pulse was still 136. And it was my day off, and my wife asked, "Are you going to take me to lunch?" And I said, "How about instead you take me to the emergency room?" And she brought me in, and my pulse rate remained high. Atrial fibrillation is the thing that hopefully it just resolves on its own, but sometimes it doesn't. And they waited here. They got labs and my troponin, which is the thing that is from heart muscle. If that goes up, it means that you've had damage to your heart attack, and that was 0. My thyroid test was fine. My other tests were fine. They go to CBC, a complete blood count. That was fine. That would show infection or anemia, and all of that stuff was fine. And we came in here, and they started an IV and got blood work and checked my thyroid and all that stuff. And then we should have taken some video of that, the things that went on before the cardioversion IV. My wife left during that, but she was only gone for about 2 minutes, and they put me out. I'm mostly back already. And so they put a pad here, big sticky pad up here, big sticky one here. They're still here. I got tons of monitor leads and stuff. And they shocked my heart. And atrial fibrillation is when the top part of the heart is, normally the top part squeezes and it fills the bottom, and then the bottom part squeezes. And it's just a nice ballet. It's just this rhythm that just keeps happening and happening. And each side, there's the right side and the left side that does it. The right side pumps blood into your lungs, the left side pumps it to your body. Atrial fibrillation, instead of a single pacemaker that's squeezing that heart and then allowing the bottom part to fill, and then that happening, the top part it gets a bunch of other pacemakers. It gets irritated, and then the top part of the heart is just wiggling like a bowl of Jello. And then some of the impulses get through, and then the bottom part beats. And sometimes a few get through, and sometimes nothing, and then sometimes another one. And then you get with this really irregular heartbeat, but usually it's fast. And 60 to 100 is the normal adult resting heart rate. Mine was 136. It went up to 148 here briefly. And so everybody came in, started an IV, got labs. They gave me some time to wait and see if I just would go out of this spontaneously, and I didn't. So they gave me some sedation, and they shocked my heart. So when the top part was wiggling like that and the bottom part was beating once in a while, they just stunned it, and then that my normal pacemaker took off, and then my heart's beating normally now. So it's beating in a regular rhythm. So I'll probably have to get my blood pressure medicine switched. I'm on one that works really well for my blood pressure, and I tolerate it fine, but it won't help my heart rate. So there are some other ones that can help my heart not go into that rhythm and keep it from going. But the cardioversion, the shock, they gave me some propofol, which is an anesthetic. They knocked me out. I remember absolutely nothing about that. The emergency room doctor was talking to me, and then he was saying, "Are you feeling okay? Are you tired?" And I thought they were worried that I was getting tired, but he was asking me if I was okay after the anesthesia and after the cardioversion. So that didn't hurt at all. I don't remember nothing, anything about that. And so I don't even know what time it is. It happened at 8 o'clock this morning. We were in here by 8:40 or so. I think they did the cardioversion at 10 after 10, and yes, Ivy, I can take you to lunch.